Prostate cancer is the most common cancer in UK men, with around 50,000 new cases diagnosed and over 12,000 deaths annually, and that's 28% of all male cancer cases. About 1 in 8 men will be diagnosed in their lifetime, a rate that is higher for black men, about 1 in 4, and a significant majority of all new cases occur in men aged 70 and over. Although survival rates have been improving, it's really important that you understand prostate cancer and the science behind it. If you're new here, I'm Dr. Jeff Foster, an NHS and Private GP specialising in men's health, and today I'll be taking you through everything you need to know about prostate cancer. What is prostate cancer? This is a really good question because a lot of us worry about the word cancer or prostate and connecting the two, but in reality, I think a lot of us don't know what it really means to have prostate cancer. So cancer itself is abnormal growth of cells in an uncontrolled and random proliferating way, which means effectively they're not growing in any ordered structure, and they can occur almost anywhere in the body, but the prostate's a particularly common area for men, and there's lots of reasons why, and I'll go into that. As we get older, our prostates get bigger, and that increases our chance of having prostate cancer. So these abnormal growths are just more likely to occur the older you get. Now, as long as you're a guy and as long as you have some testosterone, and it doesn't matter if you have a tiny, tiny little amount and you've got the worst testosterone in the world, but you've got a little bit, or you've got absolutely buckets of the stuff, that is not going to alter your risk of getting prostate cancer, but it will increase the risk. So just having testosterone and being a man will increase your prostate cancer risk. And that's a big problem because it means that the longer you have a prostate, the longer you have testosterone, the greater the chance of you having prostate cancer. What are the symptoms of prostate cancer? This is also a particularly big problem we face in men's health because a lot of the symptoms of prostate cancer mimic a benign condition called BPH, which is benign prostatic hyperplasia, or very similar to just age-related prostate. So if you imagine the prostate is normally a sort of walnut-sized organ, and your urethra, which is the tube you pee out of, goes through the middle of it, as this walnut gets slightly bigger, as we said year on year as you get older, it's going to start to squeeze the urethra. So that means that even if you don't have prostate cancer, by the time you're 50, your pee is never going to be as good as it was when you were 20, because all that's happening is that walnut is now becoming a tomato, or it then becomes the size of a tennis ball or whatever. But the point is getting bigger and it's squeezing that tube. Really good example, we used to play this game where you would see how many steps back you could take away from the urinal and still make it into the toilet peeing. And it was a great game. You know, it took in like 1.5 meters or 2 meters. At least it felt like that when I was like 8 or 9 or something. And that's because, of course, pre-puberty, your prostate has virtually no function. It's not enlarged, it's not doing anything. So your urethra that you're peeing out of has this enormous stream, and you can pee like a fire hydrant out of this thing. And then obviously puberty kicks in and your prostate gets activated and it starts to get bigger. And then every year, the squeeze just gets a little bit tighter, a little bit tighter. And the thing about it is that as a guy, you don't notice maybe that your pee's not as good as it was until you have a comparison. So most of us aren't standing at a urinal at a pub looking at other people's urinary flow, because that's a very quick way to get your head kicked in at a pub. But you might notice, for example, that, hang on a minute, I'm starting to get up at night all the time to pee, or maybe I don't quite finish properly and there's some dribbling afterwards, or it's taking a few minutes to get started. Or maybe it's just that, I remember a few years ago, you could pee with force and now it just feels like a dribble. And all these sort of things are signs that your prostate's enlarging, but it may or may not be cancerous. Classic signs of prostate disease, cancer or not, are peeing at night, so getting up several times to pee, poor flow, dribbling at the end, hesitancy at the start, feeling like you haven't emptied properly, so like you could go again 5 minutes later. And then sometimes with prostate cancer in particular, we might also notice you could pee blood, and obviously that's an obvious red flag, or you get pain in your pelvis or your bones, and again, that's a red flag as well. The only other way we can really tell this is cancerous versus just a normal aging thing is speed of onset. And some people that will have a more aggressive cancer will expand their prostate very quickly, so your symptoms come on really soon. But other than that, most of the time, we don't really know. What causes prostate cancer? We know there are lots of risk factors for prostate cancer, but we don't always know why some men are so much more susceptible than others. So prostate cancer is one of those organs that's really susceptible to things that you do in your lifestyle. We know, for example, that smoking is really bad for you and it causes lung cancer, but it does also increase your risk of prostate cancer. Too much alcohol increases your risk of prostate cancer. Being overweight increases your risk of prostate cancer. And we also know that just being generally unhealthy is not good for your prostate. We know that the opposite to that, so being sexually active, can reduce your risk of prostate cancer, but it's not a linear sort of thing. And we also know that if you are Afro-Caribbean, you have an increased risk of prostate cancer compared with Caucasian men. So there's lots of things. The biggest thing that's likely to cause prostate cancer, however, as I said before, is just getting older, because age itself is the biggest risk factor because your prostate's been there for years and years and years. How is prostate cancer detected and diagnosed? So for most men, we have to wait for them to have symptoms before we can diagnose and treat them. So we would either expect them to have a change in urinary flow, we'd expect them to see blood in their urine or pain in their pelvis, or, as I say, urinary flow, all those symptoms I discussed before. The problem with prostate cancer is we have no nationally agreed screening program for it, which is infuriating because it's such a common cancer. It's the most common cancer in men, excluding skin. And really, we should have some process that allows men to be screened. The problem is that the blood test we use, which is called the prostate-specific antigen, PSA test, is not perfect, but it's better than anything else we have. So there's an argument to say the problem with the PSA is that there is a risk of false positives and false negatives. We might falsely diagnose you with a prostate cancer and send you off to have scans, but that's not the worst thing in the world because you'd have an MRI scan and the MRI scan would show actually it's absolutely fine. So you're like, okay, it's a bit worrying, but it's not bad. The problem is there are some risks of false negatives. And if you were told that everything's okay because your PSA was normal, but actually you had prostate cancer, then potentially you're falsely reassured. And then 6-12 months down the line, you've then got a much worse prostate cancer because we missed it at the time of testing your PSA. Now, PSA is not terrible, and it is pretty specific and pretty sensitive, but we can't use it as a national screening tool yet because the argument is that those risks of false positives and false negatives are still too high for it to meet the threshold needed to be used for screening. That said, I think there is still great validity in having a yearly PSA test from the age of 50, because even if you don't have symptoms, you'll know what your baseline is, and then you can work out when your numbers start to go abnormal. For example, in patients that we treat for testosterone replacement therapy, we do a twice-a-year PSA. Even though testosterone doesn't cause prostate cancer, we want to be aware of these sort of markers. And actually having a PSA twice a year on someone is really helpful, because if your number's 2222224, even if it's within normal range, well, suddenly we've seen a blip and we know we can do something about it. Interestingly, in really aggressive prostate cancers, the ones that are really likely to kill you, we don't see a raise in PSA. We actually see a drop in PSA. And that's because the cancer's so aggressive that it actually eats the prostate and destroys the PSA and the numbers go down. But as I say, that's quite rare and it's very hard to treat those. The problem my old urology boss used to tell me around prostate cancer is that we're very good at catching and screening for the kitten cancers, the ones that will never kill you, the ones that trundle along in the background for 10, 20 years that you don't really need treatment for. We're really bad at catching the tigers, the ones that are going to kill you in the next 6 months, because we can't screen for them particularly effectively. One of the big worries that men have about prostate cancer is getting a finger put up their backside. And I can't tell you the amount of times that men have been nervous about me putting my finger up their bum. So what I should always stress as well is for screening, there is no evidence that you have to have a rectal examination anymore. And the guidance is that for screening only, a PSA test is as good as, if not slightly better, than having a rectal exam. You should only be having a rectal examination if you have symptoms, so any of those things we discussed before, and then it may add benefit. But in reality, if you just want to get your PSA checked and you want to know about your prostate, you do not have to have a rectal exam. And there's been multiple studies, especially through Prostate Cancer UK, that have said that if you are worried about having a rectal exam, that's actually stopping men going to see their doctor because they're nervous about that procedure, because it's an invasive thing to think about. If you have a positive PSA, if you have a positive rectal examination or you have symptoms and we're not sure why, the next step is usually sent to you for an MRI scan. The introduction of contrast MRI scans for the prostate has been game-changing for prostate cancer in the last few years. It used to be, 15, 20 years ago, if you had an abnormal PSA result, we would then have to do a biopsy, and that involved getting a device in your perineum, so the gap between your bum hole and your penis, and we would stick this thing in and we would randomly puncture your prostate at maybe 10 or 15 spots to try and find the spot that had cancer in it and then examine that under the microscope. Now that's only part of it because it's also incredibly painful and quite traumatizing. And you've got a urologist who's doing his best, but effectively just randomly poking at your prostate with a biopsy stick, which isn't particularly scientific. And now we have contrast MRI scans, and the contrast MRI scans allow you to see hotspots in the prostate, which means that when you do your scan, well, you can see the bit you need to biopsy. So you don't need to do it 15 random times. We can say this is the exact spot you need, and it's far less traumatic for the patient and much, much more pleasant. So if you have a positive diagnosis of prostate cancer, then the next step is to determine what stage that is and what the process of treatment might be. Part of that process is to have a CT scan, and we would work out whether there's any further markers of cancers that might have spread outside of your prostate, for example, to the lymph nodes or the bones, and to look at how much of your prostate has actually got cancerous cells in it. That's really important because it gives you a good idea of prognosis, and it also gives you a good idea of what treatments you might need. For example, if the prostate gland is the only area with a bit of cancer in it and it's very, very small, in some cases we do a thing called watchful waiting, where we don't actually treat you at all. We just monitor your prostate and we see how you do over several months or years, and we keep checking your PSA for changes. If, on the other hand, for example, it's spread to your bone or it's gone to your lymph glands, then you might be offered chemotherapy and or surgery or radiotherapy, and it's all very individual. And the guidance and reference around this is constantly changing to try and maximize the survival rate for men with prostate cancer. What are the treatment options for prostate cancer? Prostate cancer is quite unusual because we go from everything from doing nothing and just watching your prostate and making sure things don't change. Because, for example, supposing you're 80 and you're diagnosed with prostate cancer, then if it's a mild form of prostate cancer, then odds are you might actually die of something else. And aggressively treating that prostate cancer isn't going to really benefit you, because for some of these guys, as I said, this prostate cancer will just sit there for the next 10, 20 years and do nothing. The contrast to that is if you had a really aggressive form of cancer, we might want to throw everything at it, from chemotherapy, radiotherapy, and surgery. The radical prostatectomy surgery is the most radical thing we can do to take out the prostate. And it's obviously very successful in removing the prostate gland, but it does have risks, and it can be associated with incontinence and urinary issues, and it can also cause sexual dysfunction. And so we only really want to do that when you really need to do it. In between, we've got things like specific chemotherapies, and one of those is actually to give people anti-testosterone drugs. So we know that your prostate gland is really, really sensitive to dihydrotestosterone, which is one of the breakdown products of testosterone. And it's the thing that makes your prostate gland grow as you get older. But if we block testosterone completely, then none of these receptors are activated. And we see that in prostate cancer, the levels start to shrink down again. So that's why we think actually giving people complete testosterone blockers in specific hormone-sensitive types of prostate cancer can be really effective. That's also one of the reasons why people used to think that testosterone causes prostate cancer. Because, of course, if you add testosterone, the prostate grows again, but that doesn't mean it's cancerous, and that's the key. So, as I said at the beginning, a tiny bit of testosterone or an enormous amount of testosterone will make your prostate grow, but it doesn't alter the risk of prostate cancer. What are the side effects of treatment? Well, again, this is very treatment specific, and you might find for systemic chemotherapies, you might get aches or pains, you might have diarrhea, you might have vomiting, you might have joint problems and fatigue, and that comes with a lot of systemic chemotherapies, but that's also treating the wider problems like bone problems, metastases or lymph gland issues. You might find with radiotherapies, you can get local burning or pain in the area, and the anti-testosterone ones are very interesting because they effectively turn you into a eunuch because we are taking away all of your testosterone. And this is where we see the extreme form of absolutely low testosterone coming into play. So men with anti-testosterone treatments for their prostate cancer will have night sweats, they lose their muscle mass, they are virtually unable to function sexually, they get tearful and emotional, and they go through almost an identical set of symptoms to women that go through a really abrupt menopause. And that's because we've suddenly taken all your hormones away. Of course, watchful waiting has no side effects because we're not giving you any treatment. But then the risk, of course, is that your prostate cancer could still grow, and we have to be really careful about monitoring it. Can prostate cancer be cured? Absolutely, yes, it can. And survival rates of prostate cancer now are really good. In fact, the best they've been for several decades. And that's largely because we're getting much better at catching it early. So the same principle for every cancer. If you catch it before it spreads, before it gets too big, then you've got a better chance of curing it. And because we are using PSA screening for more men, actually our survival rate's much better because we can treat it much more early on. So if you remove the cancer, if you have surgery or you have a chemotherapy or radiotherapy or whatever your urologist and oncologist decides, and you completely kill the cancer, actually, yeah, you can cure it. And many, many men now will go on to survive post-prostate cancer and have a good quality of life. When should I start getting regularly screened for prostate cancer? Again, this is a very difficult question because in the NHS, there is no nationally agreed time that men should be screened for prostate cancer, which is incredibly tricky because then you're then advocating for a screening program that isn't nationally validated. However, if it was me, I would say from the age of 50, I would probably do a PSA test once a year. Now, you cannot necessarily get that through your NHS GP because, as I said, GP practices are not funded to do national screening for prostate cancer, and that makes it very tricky. So you probably are going to have to go to a charity or a private clinic to get that PSA done. But I'm a really big advocate of cumulative data, and the more data you can get around your PSA and the more we know about what your base level is, the better chance you've got of catching something early. You may equally also say, I don't want to know what my PSA is and I'll wait for my symptoms, and that's absolutely fine. Because even then, our ability to treat and detect cancers now early is so much better. But I think if you can, yearly PSA from the age of 50, it's cheap, easy to do, why not? Are there things I can do now to prevent prostate cancer? Absolutely yes. So as I said before, prostate cancer is a highly lifestyle sensitive cancer, a bit like lung cancer or bowel. So not smoking is particularly effective, not drinking too much alcohol, not being overweight, other healthy lifestyle measures. There was a very interesting study looking at frequency of sex from a couple of years ago, and it showed that if you ejaculate more than 21 times per month, you could reduce your risk of prostate cancer by 1/3. Now, when we say ejaculate, it means you obviously have to complete your sexual activity. It doesn't need to be with another person, just in case you were curious, but just to go through that process is extremely healthy for your prostate, and the evidence from the study was actually very positive. This is a tenuous one. There have been some potential links between long-distance cycling and prostate cancer, the argument being that the risk of prostatitis, so inflammation of your prostate, goes up if you're constantly annoying it by sitting on a narrow saddle for many, many years. And there's some suggestions that chronic prostatitis can increase your risk of prostate cancer. But we have to be really careful with this one because cycling generally is really good for you, and it's a good aerobic and sporting activity, and it's really popular. So I don't really want to stop people doing something that's really good for their health. Maybe the best way to think about it is if you had a really strong family history of prostate cancer, so a first-degree relative who had it, or maybe if you're Afro-Caribbean, or maybe you had previous lots of infections in your prostate, so prostatitis infections, then maybe you might choose to do a slightly different activity or sport. But overall, there's some questions around long-distance cycling. But I think, we need to do more research around that first. So the important thing with this to remember is that if you live long enough, you will get prostate cancer. 99% of men at the age of 90 will have some prostate cancer cells in their prostate. But that doesn't mean it's going to kill you. And you might have had a wonderfully healthy life, and you might go on to have another 10 or 15 years and never be bothered by a prostate cancer. But the key is prostate cancer that's going to kill you is still quite treatable. And if you do the effective things in your lifestyle, you can reduce those risks of it ever being a problem. You can't stop your prostate getting bigger, but we can try and do the best we can to keep it as healthy as we can. It's great to know and understand this information, but more importantly is what you do with it now. Make sure that you do what needs to be done to look after your own health, but also make the decision to be more open with your mates, your colleagues, and your family, as you never know how helpful this information could be for someone you love. Oh, and while you're here, make sure you're following the show wherever you're watching or listening so you don't miss any future episodes.